So a rapid recovery breast augmentation is something that I've been doing since about 2005. And I learned this technique from Dr. John Tebbetts. And what it is to have patients recover fast after a breast augmentation. So he came up with a technique which essentially comes down to three different things. One is to pick the correct size for each patient. So not just use one size in all patients, really individualize the size of the implant that you're recommending to the patient's anatomy. The second thing is what you do in surgery, and this is what Dr. Tebbetts was revolutionary in how he was able to meticulously determine the sequence of dissection when you're doing the pocket in surgery. And so he has a sequence of dissection that he taught me that allows you to minimize the bleeding and the trauma to the muscle and to the ribs and to the tissue, which then allows for the patient to have a less of an inflammatory reaction after the breast aug, which then in turn a patient has less pain. And then the third thing is what the patient does the day of surgery. And what the patient does the day of surgery is the patient is going to start motion after about 4 hours after surgery. And the motion they're going to do is they're going to slowly come above the head, very slowly, and then very slowly all the way down. And as the patient is doing that, the pec muscle is going to be moving. And as that muscle moves, there's going to be less muscle spasm, okay, which in turn there is less pain. The second thing the patient does the day of surgery is the patient is going to shower. The warm water helps with also muscle spasm, which then in turn helps with post-op pain. So those three things: picking the correct size of the implant, a meticulous surgical dissection based on a specific sequence of how you make the pocket, and then what the patient does the day of surgery. The other thing is I don't wrap a patient in an ACE wrap. That is for surgeons that do a really blunt dissection and there's a lot of bleeding, so they have to wrap the patient so that there's no bleeding. I don't do any wrapping of the patient. I only recommend a sports bra for light compression because you have pressure from the implant pushing the muscle forward, and then if you put a wrap or a really tight sports bra or surgical bra on top, it's going to push everything in. So now you have two opposing forces on the muscle from the back and from the front. And what do you think is going to happen when you have two of those forces? There's going to be an increase in pain. So I eliminate that completely.